Are you good to go?
Yeah, I'm good to go.
We can get started. Hi, good afternoon, everyone, and welcome back to the Society Seminar Series hosted by the Lucy Family Institute. This is the second one in person for this fall semester. We had Karen Howe visit us in September, and now it's a very distinct pleasure and honor to have someone as accomplished as Professor Milind Tambe join us today. He is, we've been thinking about AI for social good, social impact, and Professor Tambe has been a trailblazer in this field for the last 10 years. Before we were talking about social good, social impact, he was developing AI groundbreaking algorithms, but also figuring out how to translate them for impact, whether it's with the homeless shelters in Los Angeles or working with the police department in Los Angeles, etc. And that truly is a realization of the potential of AI. And when I mentioned Los Angeles, because he was a professor at the University of Southern California until a few years ago. And now Professor Tambe is the Gordon McKay Professor of Computer Science, and also the Director for Center for Research in Computation and Society at Harvard. So we share things about data and society and computation and society with him. And more so, he's a principal scientist and Director of AI for Social Good at Google Research as well. So that, again, is the, from academic to seeing realization and the industrial space. And in recognition of all the contributions that he has made, I believe there's no AI or award that's still left to be given to Professor Tambe. He received the IJGAI International Joint Conference on AI John McCurkey Award, Triple AI Second Gong Prize, Triple AI Robert Eaglemore Memorial Lecture Award. He received the Association of Agents ACMS Autonomous Agents Research Award, Informs Wagner Prize for Excellence in Operations Research, Morse Risk Prize, and he's also a fellow of Triple AI and ACM. And more so, as in recognition of his work on AI and public safety, he received the Columbus Fellowship Foundation Homeland Security Award, appreciation from the U.S. Coastal Guard, the Federal Air Marshal Service, and Airport Police at the City of Los Angeles. I don't know about you, I don't know any other academic who is sort of spanning all these kind of honors and awards, and he brings all of that with utmost humility, which is almost necessary to do this kind of a work. So and as I said, accomplished scholar, his H-index is about 94 and many tens of thousands of citations. So Professor Tambe, thank you again for joining us, and we look forward to your talk.
There couldn't have been a more kinder introduction, Nitish. So thank you so much. Thank you all for being here. Thank you for inviting me. So, let's see, take away this. Okay. So over 15 years, my team and I have been pushing AI and integration of machine learning and game theory and things of that nature for social impact, focusing on topics of public health, conservation, and public safety and security. The main challenge that we focus on is how to optimize our limited intervention resources. So, as a way of introducing you to some of our previous work and some of the lessons that we've learned, the first lesson is that achieving social impact and AI innovation go hand in hand. And in terms of previous work that shows this lesson, I wanted to first start with public health. We have large populations to serve, but limited number of public health resources. So a concrete example is work we've done with youth experiencing homelessness in Los Angeles, where harnessing the social networks of these youth, we are able to show that our influence maximization algorithms are far more effective in reducing HIV risk behaviors compared to traditional approaches. But this work required innovation in the area of social networks because the networks themselves are not given to us in advance, and you have to sample them. With respect to conservation, we have large conservation areas to protect limited number of ranger resources. So concrete example is what we have done in Uganda and Cambodia. We're harnessing past poaching data. We are able to predict the poachers set traps or snares. And for the past several years, have been able to remove thousands, if not tens of thousands of these traps. This work required innovation in the area of what we call green security games, which combines machine learning and game theory. With respect to public safety, we've contributed a new model called Stackelberg security gains and contributed new algorithms that have been in use by security agencies in the United States, such as the US Federal Air Marshal Service. So if you've been on an international flight by United, Delta, American, whether there was an air marshal or not on your flight, may have been our software. Or patrolling patterns for the US Coast Guard, work with the LA Airport Police to determine where to set up checkpoints and things of that nature. So all of this work required long-term commitments from our research group. So for example, the work in public health has been in the making for 10 years or more. And these may seem like very different applications, but they're all tied together by underlying common models that come from the area of mobile systems. The second lesson is that when we talk about AI for social impact, the entire pipeline from data to deployment is crucial. In particular, we start our process by immersing ourselves in the domain, talking to our partners, trying to understand the data they have, the problems they face. Following that, a machine learning model typically makes predictions on which of the cases they face are high risk versus low risk. And following that, we have an optimization phase. And right here, you can see this combination of machine learning and optimization that I'll come to repeatedly in this presentation. What is really important in AI for social impact is that we take this all to the field, test it, and then deploy it. This is AI for social impact. So if there is no social impact, this is not what we're doing. So social impact itself is a first-class citizen of the work that we do. So with that all background, let me talk to you about some of our recent work. I'm really excited to share with you this work on AI for maternal and child care with two of the world's largest mobile health programs. The one, which is called ML+, is a Mumbai-based program with 200,000 mothers enrolled at a time. The second, Kilkari, is a Government of India program. It's a pan-India program that has 3 million mothers enrolled at a time in the program. The main result here is improved access to health information to these mothers. I'll also talk a bit about our past work on AI for HIV prevention in Los Angeles and close out with work that I mentioned about AI for wildlife conservation. I'll discuss mostly papers from the last 2 to 3 years, mostly focusing on real world results, but if you're interested in simulations and theorems, you'll find them in our papers. I'll try to put the picture of the lead PhD student who did the work in the top right-hand corner of the slide on which their work is shown. I also wanted to highlight the role of a key collaborator, Aparna Taneja from Google Research India, who's a co-author on many of the papers on AI for maternal and child care. So let me start with this first project on ML+, this mobile health program. There's a maternal health crisis around the world. The UN Sustainable Development Target talks about maternal mortality ratio, mothers dying during childbirth or soon after, going below 70 per 100,000 live births. That's the UN target. Where we are in the world today, the dashed line is the UN target. Western Europe is like 4. The United States, the numbers are increasing, still below the dashed line though. If you look at the rest of the world, the situation is much worse. The numbers are more than double what the United Nations target is. But this is not only a problem that's out there. As our former dean of Chan School of Public Health points out, for Black women in Mississippi, the mortality ratio is 65.1 deaths per 100,000 live births, 20 times worse than women in Greece, Poland, or Slovenia. So this is a problem that's up everywhere. It's not just a developing country problem. But today we will focus on this maternal health crisis in India, with this maternal mortality ratio being higher than the UN target. We are very fortunate to be working with a nonprofit called Arman, which is active in 20 states in India. This is a massive nonprofit, works with 41 million beneficiaries in India. And we are very inspired by the founder of Arman, Dr. Aparna Hegde, who points out that pregnancy is not a disease, childhood is not an ailment, and dying due to a natural life event is not acceptable. I met with Dr. Hegde in Starbucks in Mumbai in 2018 or 2019, and was very inspired by her words and decided to orient our lab towards working with this nonprofit and seeing what we can do with them. The initial problem that we decided to focus on is their mobile health program called ML+. This is a program for new or expecting mothers. The basic idea here is a weekly automated 2-minute voice message that goes out to the mother in their local language. From the time the mother registers to the time the baby is 1 year old, there's a message that goes out to the mother to inform them about what they should do appropriate to the gestational age or the age of the baby. So for example, this is a small snippet of one of the messages. Each message is about 90 seconds or 2 minutes long. So for this one, it's talking about needing lots of iron, eating leafy green vegetables, and so forth. And Arman has shown, so far 2 million women have benefited from this program. And Arman has shown that in randomized control trials, so there's 141 messages that go out from the time the mother enrolls to the time the baby is 1 year old. In randomized control trials, mothers who listen versus mothers who don't listen to these messages, you can see an enormous difference, 30% increase in infants with triple birth weight at the end of the year, significant increase in women who had more doctor's visits and so forth. So this is a very useful program. So where do we come in? Unfortunately, 30 to 40% of the mothers who enroll will drop out of the program. They enroll and then start becoming low listeners and drop out. The question is, why is this happening? To understand this, of course, I've grown up in the city of Mumbai, but nonetheless, with this nonprofit, we went to the houses of these mothers. So these are all people from lower socioeconomic strata. 95% of the beneficiaries of Arman are way below the international poverty line. So that's their earnings. And so there's a lot of pressures why they wouldn't want to continue listening. But nonetheless, we can do something. And that is, Arman has this call center from where they give service calls to these mothers. So these are human calls, these are not automated messages. Trying to give advice to these mothers to say, why don't drop out of this program, stay in the program, and so forth. But this is a small call center. It cannot call all 200,000 mothers at a time. So who do you call? So as an example, supposing we had 100,000 beneficiaries enrolled in our ML+ program, every one of them every week gets a health message. But to stop the dropout, we can only call 8,000 of them via live calls from the call center. And question is, who do you call in order to maximize the total retention in the program, the total number of health messages that are listened to? To make this even more concrete, consider this single health worker who has 5 mothers under her care. 4, shown in red, have not listened to a health message last week. 1, shown in green, has. And now the health worker in this case can only call 2 of these mothers this week. Which 2 should she call? So supposing she calls the first 2, they are in red, it's a good choice. They turn to green. And someone else in addition also turns to green. So that's a good choice. Now, again, next week, you have to decide who to call. So in this case, again, the health worker calls the 2 who are in red. But this turns out to be a bad choice. Not only the ones who are in red don't turn to green, but the ones who are in green also turn to red. The point here is that in selecting these 1,000 mothers, there's enormous challenges because a call may not change a beneficiary state, and a beneficiary may change their state on their own anyway. So how do you choose the 1,000? We appeal to this technique called restless bandits to choose K out of N mothers. For those who are not familiar with restless bandits, what it does is each mother is modeled as a Markov decision process. So each mother can be in a bad state, she has not listened to a health message, or a good state, she has listened to a health message this week. We can call this mother or not, those are the actions available to us. And based on whether we call or not, there's a transition probability modeling the behavior of the mother. If we give an intervention call, a service call to this mother, the probability that she goes from bad state to good state is 0.8, higher. But if we don't intervene, then the probability the mother on her own goes from bad state to good state, starts to listen, is 0.2. So every mother gets modeled by this Markov decision process. So in reality, we have 100,000 arms, we have 100,000 of these Markov decision processes. Now we have to choose 1,000. This problem is known to be space hard, it's computationally difficult. But fortunately, there's an index called a Whittle index that can be computed for each of these arms. And informally, it gives us the benefit of intervention. Formally, it's defined as the infimum subsidy that should give to a passive action in a state such that the Q value of the passive and active action becomes equal. But for the purposes of this talk, you can see that the Whittle index is a way of ranking them. So if you compute the Whittle index for each arm, and then 100,000 of these arms, each of them has an index, and you take the top 1,000 values, and those are the mothers we're going to follow. There is no out-of-the-box algorithm available to compute Whittle indices in general, but fortunately, we had a paper in 2016 which gave us an algorithm that we could use. So at this point, we can compute the Whittle index to rank these arms. But what's still missing is we actually don't know the behaviors of these mothers. We don't know the transition probability. But here's where we can rely on past data. So we have previous data for beneficiaries, who had enrolled in terms of their features, age, income, education, and their behavior. They were in a bad state, they got a service call, they remained in a bad state, service call, good state, etc. So using all of that data, we can learn a mapping from their features, age, income, etc., to their behaviors, to the transition probabilities of this MVP. And so now, once we have these behaviors, we can then select the top 1,000 mothers using our Whittle index. And now it's time to actually evaluate this in the field in practice. And so remember here, there's two stages. One, we maximize our learning accuracy. And then once we have learned these behaviors as accurately as possible, we optimize and select the top 1,000, two separate stages. And now it's time to evaluate. And so to that end, we ran a study with 23,000 mothers. This is the first application of these restless bandage for public health, as far as we know. These were divided into three groups. 7,667 per group. One is restless bandage group, one is round robin group, and the third is current standard of care group. Remember that each beneficiary in each of these groups continues to get this automated voice message. What changes is service call. So in each of these groups, we pulled through 25 arms, that is, gave service calls to 225 mothers. In the restless bandit group, the 225 mothers were the ones who had the top Whittle index. They were ranked higher. In the round robin group, we call the first 225, then the next 225, then the next 225, etc. In the current standard of care group, no service calls were going out. Everybody was getting health messages, but no service calls. And now we want to know, with this AI technique, how many more health messages are listened to compared to the current standard of care. And so here's the result. On the x-axis here are different weeks. And on the y-axis, cumulatively, how many more health messages these mothers have listened to. What we see here is that compared to the current standard of care, the round robin approach improves very little, hardly any improvement. But the restless bandit group shown in blue, you can see 600 more messages are listened to by these mothers. So the main point to take away from here, it's important to optimize service calls. If you just call people using round robin or whatever, there is no improvement in health messages that they listen. In fact, there's a 32% cut in the drop-off rate compared to the current standard of care using this restless bandit approach. If you wanted to look at the statistical significance results and so forth, there's an R in a AAAI paper. So with this, we began to deploy the first version, but we wanted to do something better. And here I wanted to highlight to you a better integration of machine learning and optimization. So remember this data to deployment pipeline. I talked to you about the two stages. First, you maximize learning accuracy, and then you optimize. However, maximizing learning accuracy doesn't mean you maximize decision quality. And in fact, I want to show it to you with real data that we have. So there are two data sets here, the orange and the blue. The orange data set is one that leads to higher prediction accuracy. We can more accurately predict these mothers' behaviors. Blue, we have less accurate data, less accurate predictive accuracy. So you would think that the orange, if we use vitamin indices using orange, we optimize using orange data set, it should lead to better results, more health messages getting listened to. But in reality, it's exactly the opposite. Orange actually leads to less health messages being listened to. Blue leads to higher performance in the optimization stage. So why might this happen? So let's look at this very illustrative example. On the x-axis are some feature like age. On the y-axis is transition probability. The blue are all the low-risk mothers. The red is the high-risk mothers, and there's a lot of blue. And now if we maximize learning accuracy, you see a green regression line here that's drawn. It learns to predict the behaviors of the mothers accurately. We're targeting on the blue mothers, forgetting the ones that we really want to predict about, which are the high-risk mothers. So it has high learning accuracy, but low decision quality. Decision-focused learning modifies the loss function so that it directly optimizes the decision quality. So now you learn this green regression line, which you can see is bad in terms of learning accuracy, but good in terms of higher decision quality. It gets us what we want, which is a high-risk mother. So in terms of what's happening underneath, in the two-stage approach, you're trying to get gradients to maximize the MVP transition probabilities accurate. In the decision-focused learning, you're differentiating all the way through to get the higher solution quality. This requires establishing that the Whittle index itself is differentiable. And this work comes out of my PhD student Tai Wang's PhD thesis, where he showed the differentiability of the Whittle index via a set of linear equations. So now that we have got this decision-focused learning, we implemented that, and now we again did a field study with 3 groups with 9,000 mothers, 3,000 in the decision-focused learning arm, 3,000 in the two-stage arm, and 3,000 with again current standard of care. And if you look at predictive accuracy, the two-stage approach leads to higher predictive accuracy. The decision-focused learning doesn't lead to higher, is shown in blue. But now we give service calls based on this model. And if you look at the service calls, how many more health messages are listened to compared to current standard of care, then with the blue, we get significantly higher number of messages listened to, whereas with orange, with the two-stage, the increase is much lower. So this is just showing you the benefit of this decision-focused learning rather than relying on this maximizing learning accuracy. So the result of all of this is a system called Saheli. This is an acronym, and it also means a friend in Hindi. This is just to tell you that we work very hard to come up with good acronyms. This system has served over 300,000 mothers so far. It's been in continuous use in April of 2022. It has prevented 30% of drop-offs over current standard of care. And for the bottom 25% listeners of mothers, the amount of access to more health information has more than doubled. So all of this has been appreciated by our collaborators, Dr. Aparna Hegde, saying we are able to reach out to more and more women each week and get them back into the fold and save lives because of AI. This is all is part of this YouTube video that's very nicely made, AI for Social Good, in partnership with Arman. And I'm now going to play a video. I hope this technology works. So this is a beneficiary's interview.
मिस्टर फोन नव्हते ऐकत पहिला त्याच्यानंतर मला त्या ताईंचा कॉल आला त्या घरी आल्या मला समजवलं हा कॉल घ्यायला पाहिजे तुझ्या पोरांसाठी चांगला आहे हा मग तेव्हा मी कॉल घ्यायला लागले ते कॉल ऐकून खूप बरं वाटतं की कोणीतरी घरचंच मला कोणीतरी समजावायला येतंय मग जसं ते कॉल ऐकते मी तसंच मी माझ्या पोरगीचं संगोपन करते.
Hopefully that came through. Awesome, thank you. So this is a mother speaking in Marathi, which is also my mother tongue, in Mumbai, in the city I grew up. So very satisfying to see my research being used in Mumbai by this mother. So very grateful for that. I wanted to talk to you about some of our next steps here. One is to get to more robust top K policies. So first of all, I said we can be predicting this exact transition probabilities, exact behaviors. Rather than that, if you can predict intervals of uncertainty. So we say, the transition probability is in an interval of 0.4 to 0.7, or in an interval of 0.2 to 0.4, rather than being forced to predict an exact number. That may allow us to come up with better models. And so we can solve these kinds of problems by an approach of minimizing maximum regret. So on the one hand, we say, okay, we are trying to come up with a policy that improves our behavior, improves the listening behavior the most. Nature is trying to choose transition probabilities within these intervals to cause our algorithm to perform as worse as possible. So we are playing a game against nature, like nature is trying to act against us, and that would allow us to come up with a more robust policy. And so this is done by solving the game. On the one side, we are trying to come up with a policy, and nature is trying to come up with bad transition probabilities for us. There's a way of solving these very, very large scale games that I'm not going to go into. But in simulation, you can see that the robust approach leads to lower regret, which is what we want, compared to orange, which is the original approach. Another idea is online learning. So far I've talked about we take past data and learn behaviors, but we don't personalize the behaviors over time. And so this can be done by online learning based on the data we receive online. And so we have an approach called upper confidence bound whittle. So basically the approach, you may be familiar with upper confidence bound algorithms for stochastic bandage. So this is a slightly different version of that. Here, we select the top K arms to pull, top K mothers to call. Based on that, we maintain confidence bounds on transition probabilities of these mothers. But a higher transition probability doesn't lead to higher Whittle index. So therefore, we have to figure out who are the top K mothers with a higher Whittle index, and you continue on in this fashion. Again, in simulation, x-axis is time. More personalization happens. On the y-axis is regret. Lower is better, lower regret. And these upper confidence bound Whittle algorithms lead to lower regret in simulation. So these are things that we want to try out in the field in the future. I also wanted to talk about generalization of this approach of restless damage to other health conditions. One approach, one condition is tuberculosis. Tuberculosis is a disease that kills 1.6 million deaths worldwide. In India alone, 500,000. And so question becomes how to treat these patients. They have to take their medicine for 6 months to kill the bacteria. So every day they have to take this medicine, and I get tired if I'm asked to do something for a week. 6 months is a very long time, and people drop out, and that's bad for them because they don't get cured, and it also leads to drug-resistant bacteria. So once again, there's a call center from where these patients get called to remind them to take their medicine. But now we don't know who has taken their medicine yesterday or not. So imagine a health worker now deciding, I have to call 3 patients today. Which 3 should I call? So she calls the first 3, 2 of them turn to, 2 of them tell her, hey, I took my medicine. One says, I didn't take my medicine. That's shown in red. Now she has to decide tomorrow, which 3 should I call to remind them? And so she may call some other 3. This is very similar to the problem we just discussed in maternal and childhood. The difference is that the state of the patient is not known in advance. You don't know whether they took their medicine or not. So this is a partially observable Markov decision problem. We show a fast algorithm to solve this problem using the fact that uncertainty collapses whenever you call a mother. Whenever you call a mother, in this case, a patient, the patient immediately says, I took my medicine or I didn't take my medicine, and uncertainty collapses, and this collapsing uncertainty can be used to come up with a fast algorithm. Another problem is diabetes. It affects 422 million people worldwide, and there are now digital apps that log exercise, talk about the medication you've taken, or your blood sugar level measurement, and so on. And so once again, there's a problem because for people who haven't been on track, there are health coaches who can be sent to those people to try to coach them better. And again, it's a problem of limited resources. And we've shown that these, in terms of these apps, we can show that this RMAP approach leads to a better result. A third and final approach I wanted to talk about is more leading to a large pre-trained model or trying to be a foundation model approach. So imagine a situation now where instead of a single intervention on a patient, there are multiple interventions. A patient could be given a call, but they could also be a home visit. They could also be a text message being sent. So there are multiple interventions possible on each arm. In such a case, and also a situation where these beneficiaries may opt in or opt out, they may drop out, and new beneficiaries may join. It's a rolling program. In these kinds of situations, which are realistic, real world, a Whittle index policy does not apply. Whittle index requires there's only one intervention. Now there are multiple per beneficiary. So the state of the art, instead of using Whittle index, is a reinforcement learning based approach called DLPO. It trains a model, but it cannot be used out of the box. It means that every time there's a new set of patients, a new set of mothers, you'll have to retrain the model and then start using it. So our approach has been to come up with a new pre-trained model that is a model-free approach to reinforcement learning rather than the decision-focused learning approach that we saw. Key innovations here over the DDLPO approach is this using the single policy network and there's a new lambda threshold. Lambda equal to 0 means no budget. Lambda equal to infinity means there's a very, very strict budget. You almost cannot pull any arms. And so with this pre-trained model, we have shown that we get zero-shot generalization. That is to say, if a new set of beneficiaries walk in, it can do something with them, given their features. And so this is showing you the result on 3 simulation domains, synthetic domains. The DDLPO shown in gray is one where, with a new set of patients working in new cases, it was trained from scratch, and then we checked its performance. The orange is no training at all. It was trained on some other cases, and now we bring it into the world here, and it seems to work just as well. So this is hopeful in terms of applying this to newer scenarios. And also, if 20% of the people walk out of the situation, they drop out of the program, with this newer prefer map approach, it continues to do well, whereas the DDLPO approach would need to be trained from scratch. So this is an exciting direction for us to go in terms of being able to apply this to newer situations. So I'm now going to switch modes and talk to you more briefly about a second case, which is this AI for maternal and child care. This is Kilkari is the world's largest mobile health program. It's a government of India program where it's similar to the ML+ program, mothers getting calls in their local language, 2-minute messages, 1 per week. 30 million beneficiaries have benefited from the program. At the time now, 3 million mothers are enrolled in this program. And Arman is being tasked to further scale up this program India-wide. So these are pictures from me visiting various sites in India to look at how this Kilkari program functions. And there's lots of challenges. First of all, we don't get any demographic features, age, income, etc. There's nothing available to us other than the fast listening behaviors of these mothers. So only time series data is available. And so we will use a non-Markov time series stressless bandit, as I'll show. Second, they're multi-action RMAPs, as I just discussed. And thirdly, we have limited beneficiary data. This is when to make a call is also not known. I'm going to talk to you only about the first challenge in that. So normally in the Arman case, in the ML+ case, we were predicting mother behaviors using their age, income, education, their futures. Now we have none of that. So what do? So we look at their past listening behavior to predict their future listening. So we are predicting that, okay, they're going to listen to 30 seconds based on, oh, they listened to 60, 70, 80 seconds in the past. And this graph is showing you on the x-axis Markov model order. This is saying the more you keep the past messages, the better the accuracy. So if you listen to only, if you use only the past 2 message listening lengths to predict the third one, that's not as good as if you had 3 of those or 4 of the past messages to predict. So the longer the time window, the better off you are in improving your predictions. And so now we use this time series prediction approaches, this LSTM, with data from the state of Odisha in India. So it's making predictions of what's going to happen if the mother number 1 listened to a certain length of the message shown in green in time step 1, time step 2, time step 3, she didn't listen to it as much, the third message as much. And now we want to predict what's going to happen next. So we can train a model to make these predictions. And then to select the top K arms, we take this ratio that we call this time series arm ranking index. UN refers to the time for the beneficiary to go, drop below the listening threshold if we intervene. VN is the time for the beneficiary to drop below listening threshold if we do not intervene. So the higher the ratio, the more we want to pull this arm, the more we want to give a service call to this mother or send our health workers to their home. And so this is simulation study, 4,000 beneficiaries, 1% got health worker intervention, 1% got automated phone calls per week. And this is showing you on the x-axis different weeks, on the y-axis how many more health messages were listened to. We can see that the ones that were selected using our index approach led to higher listening over time, whereas the random approach of just calling people at random or intervening on people on random doesn't lead to as higher listening.
So just to try to understand here, Milind, the intervention here is the two hypotheses that we have, the UNVN. Intervention is your index, or is the intervention ASHA or automated phone call?
So the UN to VN ratio is a way of ranking the mothers. The higher the ratio, the higher the probability, the higher we want to.
What's the intervention mechanism?
So there's 2 interventions that are happening.
Okay.
One is health worker intervention and automated phone call. Both are happening.
But you also mentioned the index-based intervention.
Those with the highest indices. So the indices are calculated in terms of ASHA intervention and the phone call intervention.
Okay.
And then the top ones who rank higher with ASHA intervention, you are going to get the health worker intervention. And the ones who rank high in terms of phone call intervention, okay, you are going to get the phone call intervention. And so you sort of basically are ranking these mothers based on whether they phone call or health worker, and then you get these interventions, you get these interventions. You rank higher on, intervention due to a health worker, you rank higher because intervention due to a phone call, and you go ahead and intervene. So this is done in simulation right now. Is that
Yeah,
okay?
sounds good. Yes.
And so this is a different way of combining machine learning and optimization. And we are very excited to start a field study in December 1. First, with the actual health workers will go out and intervene.
May I ask a question,
Please.
First, it is fantastic.
Thank you.
The work you do is great. And so with this problem that you don't have demographic information, that you have the behavior in the system, can you reverse engineer some of the demographic information? For example, like depending on the time when you're calling, a person may or may not answer, so you maintain some other orders or stuff like that, and then adjust some operational parameters as opposed to just a decision of whom to call and so on. Because the behavior reveals some signals, I suppose, about demographics that will remain unknown, but we can perhaps get with some surety.
Perfect. So this is a separate problem of guessing the time to call.
Okay.
And here, this program is so large, they don't take into account the time to call. So they don't note down when is the mother preferred to be called. So they just call at some random time, and the phone is not picked up. They'll try 9 more times and then stop. And if the mother doesn't pick up, no deal. And sometimes the calls are right after one another, sometimes like the next day, sometimes the next. But you're absolutely right that it reveals some information. And because these are low-income families, there's a shared phone. If the husband takes the phone is gone for the whole day. and the mother has to then only pick up the call when the husband is home. So there is there's a machine learning problem here, which should start with the bandit problem. I'm sure further improvements can be made. But to learn from the success or failure of when the call succeeded or not, guess what is the right time slot to call. So that's something that is in progress. And so thank you for that question. I didn't want to go into it here just for lack of time, but that's exactly it. Okay, so I just wanted to say that some of this work may go into other areas of the world. We have worked with a nonprofit called Telecom in Nigeria in order to help them come up with optimization of their resources for uptake of vaccines for children. And we wrote just a theoretical paper with them. They have taken this one to the streets and applied it in practice. And so we're grateful that I this out and it's working well. So now let me turn to the third project I wanted to highlight for you, which is HIV prevention. So this was from the time I was in LA, and right outside university at USC, there was this encampment of homeless, and so it was important to try and see what can be as researchers do. So to that end, I started working with the School of Social Work there. 6,000 youth sleep on the streets of LA every night. The rates of HIV in this population are 10 times the rates of the normal house population. So what homeless drop-in centers do, for example, is you can't go and talk to all 6,000 youth. So you select key peer leaders, educate them about HIV prevention, expect them to talk to their friends to talk to their friends, and in this way information to spread in the social network. Now, these are real face-to-face interaction. There is no Facebook data or anything like that. So just to make this more concrete, each number here is a youth, each edge is a friendship edge, each of these red edges, and you have to select key influencers, let's say 3 influencers here, so as to maximize the expected number of influencers, those who know about HIV prevention. And this is our colleague from the School of Social Work educating these youth from one of our sessions. Information is supposed to spread in this independent cascade model, so you educate the youth, see about HIV prevention, safe sex, etc. They'll educate them, friend D with the probability of 0.4, and if D gets educated, then they'll educate this person E with the probability of 0.4. So information cascades through the network. Now there's 2 decades of work, maybe more, on this algorithms for choosing the right influencers in computer science. But when you take it to the field, there are 3 major problems. One, propagation probability 0.4, etc., that I mentioned is not known in advance, which is often assumed to be known. Second, we need multi-step dynamic policies. These are youth under difficult circumstances. We ask them to become influencers, but by the time they arrive, they get arrested on the way, and one of them will decide to run away from LA and send their friends. So we get a different group of influencers than the one we asked for, which requires us to have a multi-step policy, which means some people didn't show up, different people showed up, bringing the next set of youth and so forth. And thirdly, we don't have a social network. It's, this was an interesting experience where first there was an algorithm developed in the lab, assuming the network is available, because that's what we'd be talking about with the homeless shelters. And we go, okay, now there's an algorithm, let's try and deploy it. And they said, well, just, give us the network. If there's no network, you have to figure this out. And so that led to some way of trying to figure out how to solve for these problems when the network is not known in advance. And this was the work of my PhD student, Brian Wilder, where data collection is costly. You can't go to a homeless shelter and talk to each homeless shelter, figure out the whole social network. Instead, we want to query 10 to 15% of these youth. Having gotten just their social network, we've got a sample of the social network. Choose K peer leader nodes such that the influence that they would spread would be similar to what you would get had you known the whole network in advance. So the cleverness then is in the sampling strategy. And so Brian came up with this algorithm for sampling nodes randomly, estimating sizes of the communities, and then choosing seeds from the largest K community. And so there's some mathematical backing, which I'm going to skip over and say we built this system. It's called Change. It has this network sampling, samples 10% of the youth. by going to the homeless shelters and talking to these youth. And then it comes up with this robust multi-step policy to choose peer leaders. And now it was time to test it in the field. Go ahead.
And is that sampling being informed in progress?
Yes.
Knowing where people could enter,
That's right. So if the samples were low, then based on that information, samples the next node and then go on this fashion. Yeah. And so it stops when 10% of the population is covered, then it will stop, and now whatever I can go. So in this case, there was a 750 youth study with Professor Eric Rice in the School of Social Work at USC. 250 were in the change arm, so the influencers there were selected using change. Degree centrality was second arm, bring in the most popular youth. This is the most traditional approach. And control group, no influence being spread. And now we want to see what is the actual reduction in HIV risk behaviors 1 month after this initial influencing was done and 3 months. So we call in the influencers using our particular algorithm for that arm, educate them about HIV prevention, and wait a month, wait 3 months, and see what happens in the community. This work was done with 3 homeless shelters in LA, My Friend's Place, Los Angeles LGBT Center, and Safe Place for Youth. Again, first large-scale applications of this influence maximization for public health as far as we know. At the end of 1 month, if you look at reduction in condomless anal sex, which is one of the indicators of this HIV risk behaviors, we can see that change has a much higher reduction. Degree centrality and control, there is no reduction at all. At the end of 3 months, degree centrality approach begins to catch up, but change is still superior. And the fact that this reduction happened faster is important because this is HIV risk behavior. And in fact, because it's a community field where people come and go, having this reduction happen faster is important. We also looked at reduction in condomless vaginal sex, and again, similar behaviors and change being superior. The statistical significance results in our papers. And again, I want to play a video if that works, from our partner.
Beautiful way to kind of like marry this tech world with this social service world, like, and how we can kind of go deeper and impact young people and elevate them.
All right, so with that, how much time do I have left? Maybe 5 minutes, 10 minutes? Okay. So the last 10 minutes, I'm going to quickly go through the fact that, okay, we have a lot of areas of future work, ensuring fairness and who gets influenced in terms of different communities using our reinforcement learning rather than these algorithms we have. But I wanted to talk to you about the last bit, which is AI for wildlife conservation. So in national parks around the globe, this one in Uganda, there's wonderful wildlife. This is my own photograph of this wonderful wildlife, but there's threats to the wildlife, traps or snares that get placed by the thousands. And this is a recent picture from the Murchison Falls National Park. You see a mountain of these snares that get placed that maim and kill all this endangered wildlife. And so you can imagine a small number of rangers that are asked to patrol these huge national parks through this grass, trying to look for these traps. This is very difficult. So what can we do? So we divide up the park into 1 kilometer by 1 kilometer grid square. And now we want to predict which grid square has a higher probability of finding these snares, so we can send rangers there. And then, having taken the prediction from machine learning, we then use this game theoretic approach to try to optimize where they should patrol. And I'll come to why we need this kind of an game theoretic approach shortly. So let's talk about just the prediction phase here first. So we came up with this model where, given 14 years of past data from Uganda in terms of range of patrol frequency in each grid square, the animal density, distance to rivers, roads, and villages of this grid square, and past data on whether a snare was found or not in that grid square, we are trying to predict in the future whether there will be a snare placed in this grid square. So we did all kinds of studies, showed results in simulation, not good enough for our partners. They wanted a study in the field to show the usefulness of our work, predict whether they will be able to find snares in areas where they have done no patrols or infrequently patrols. So this was done in Queen Elizabeth National Park. You see these 2 grid square, these 2 areas with a lot of green dots. These are our predictions. where they had not patrolled. The red are all the dots where they had found snares. We don't want to go back to those same areas that we found snares there in the past, go there. No, we are saying you didn't patrol in this area, go here, you'll find snares. And then they said, okay, we'll patrol this for 1 month and let you know what happened. This happened to be 1 month before a conference deadline, so the students who did the work were like, okay, you can get the snares, we try the paper, no snares, no paper. And for 1 month, these rangers patrolled and they would send us an email every day saying, nothing found, nothing found. And so it was not looking very good. Then at one point, they sent us a picture of a poached elephant with its tusks cut off. So at least the machine learning model was telling us to go in the right direction, even though we were too late to save this elephant. But the next day they said, oh, we found this whole elephant snare roll and we removed. So poachers were active in the area, they were killing elephants, but before they could kill the next set of elephants, we found this elephant snare roll and removed it. And then a whole set of antelope snares were found and removed. So I wasn't really hopeful we would find anything, but just to encourage all of the students working on this project, I had offered them a free drink per snare found. At this point, they were like, okay, now we can't drink anymore. So this was good. This led to now a more systematic study in 3 national parks around the globe: Queen Elizabeth and Murchison Falls in Uganda, Shipok Wildlife Sanctuary in Cambodia. In each park, we predicted for 24 areas. Some high risk, we predict you're going to find snares, some low risk, you're not going to find snares. And these are all areas where very little patrolling is happening. So you're not just saying go to areas where there's no patrols will find snares. We are discriminating among these areas. And then we ask rangers to go patrol them for 6 months and come back and tell us what happened. And here's what they found: where we predicted high risk, indeed more snares were found; where we predicted low risk, less snares were found. In Cambodia, in the Shipok Wildlife Sanctuary, 2018 to 2019, there was a 5-fold increase in the number of snares found. These are pictures that came to me on January 1 of 2019. Hey, we found all these snares, which was like a great New Year's present. And then 2021, I mean, this is ongoing. The 1,000 snares found in March. Every time you get an email that talks about, oh, we found this lot of snares. Okay, this is excellent in terms of being able to be helpful to these rangers. So I talked to you about the fact that there's machine learning to make predictions, but then there's game theory to try to tell the rangers where to patrol. Imagine that we have this grid square. We found a red high probability of snare placement dot grid square, and one low probability shown in orange, somewhat lower probability. And we tell the rangers, go to the most high probability locations to find snares. The poachers are smart, they'll see what the rangers are doing and switch places and go to the orange spot. So this leads to a game where, on the one hand, the rangers have to randomize their patrols in order to keep the adversary guessing as to where to put the snares. And so I'm not going to have time to go into how to solve these games, but these are stack to work security games for randomized patrols, where we get the poacher model from our machine learning. The end result of all of this is a system called PAWS, which is the system that we've developed. It's now integrated with SMART. SMART is this platform used by rangers worldwide to note down where poaching is happening. So this is the database that looks into the path of where poaching is happening. So PAWS can sit on top of SMART and make predictions of what will happen in the future in terms of where poachers may attack. So this has made PAWS available to 1,000 national parks worldwide, which is excellent. So we are hopeful the system can now be of some use to rangers worldwide. There's a lot of software hacking to be done. So this is, a lot of software engineering in progress, but this is beginning to be available to different national parks. And to make that all happen, our team members have been going to different parts of the world. So this is Rio Bravo, where we did field tests and provided documents for policy support. This is my student, Lily Shu, in Uganda this year, trying to continue our work forward. So I wanted to just highlight one recent result, which is very exciting for us because it's the first causal result for poaching deterrent. So the question in conservation is, okay, we patrolled. How much quantitatively did it impact? poaching deters. Did it deter poachers at all? In fact, I mean, we would think so, but exactly how much? And so this is what, we can't do randomized control trials here because that wouldn't be ethical. And there's imperfect snare detection because when we don't find the snare, it's like, did we miss the snare of there or there was no snare there? And so these are two obstacles that were overcome. The RCTs not being physical, being available was overcome by the fact that there were some historical field tests that were used. And the result of all of this is to show that if you increase patrol to 1 kilometer extra patrol in an area, there's a 45% reduction in poaching probability in this national park, Murchison National Park. So this is an exciting result in terms of poaching decreases with more range of patrol. And this is an important question in conservation that we were able to answer. Okay, so this is the end of my presentation, and I'm going to end with some lessons that we have learned. First, achieving social impact and AI innovation goes hand in hand. I hope I have shown you that. Second, partnerships with nonprofits, with governments and local communities is crucial for AI for social impact. We don't want to be engaged in helicopter science. We go into a community, get data from them, publish a paper, and go away. We want to be there and see through the impact being accomplished. So we want the whole data to deployment pipeline. It's not just about improving algorithms. It's important to step out of the lab and into the field. This is a thing that is more important for AI researchers to step out of the lab. Our conservation scientists and conservation biologists, obviously they are out in the field. Embracing interdisciplinary research with social work, conservation. And finally, often we find that lack of data is a norm. Social networks themselves are not available in advance. So this should be part of the project strategy to deal with the fact that there is this lack of data, and that's where often people get their PhDs. So that's it. That's the end of my presentation, and thank you all for listening. Thank you.
Thanks so much for this wonderful presentation and very inspiring. I have a question regarding the first project you presented. We've had a request from several NGOs, non-for-profits here in the US, to give assistance to the refugees that arrive here. They have a lot of historical demographic data, each of the NGOs, and they have to prioritize to which refugees they give more assistance, considering that they're all talking different languages. So it's a kind of similar problem. So do you think we could somehow use the pre-trained model that you have developed and customize it for this particular scenario?
I mean, the approach of personal language would be certainly would seem somewhat useful. I mean, here I would say we would need to do this and understand more. The pre-trained model probably, once we understand that this approach is a good approach, maybe that's where it could be used, but it would also depend on how much data is available. But very exciting. I would love to talk to you more and follow up and see, if there are possibilities here. They're very, very interesting.
Thank you.
One of the lessons you mentioned is the interdisciplinary work. I wonder if you could tell us a little about how you approach that. I have been trying to work with people from other disciplines apart from mine, and we always get to a point that incentives don't align anymore. For example, I have to publish in a set of journals, they have to do another set of journals, and so forth. So how do you try to align this incentives between different disciplines so you can produce something that's valuable?
It's an excellent question. I don't think I have a one-size-fits-all answer, and so forth. I'll try. There's clearly a lot of challenges here in terms of getting different disciplines to work together. I've also been in meetings with two junior professors talking to each other. One says, one is social worker, the other one is a computer scientist. The social worker says, we were talking about substance abuse prevention, and the computer scientist says, you need to give me an objective. And the social, I've been giving you the objective of, we have to reduce people who are doing the substance abuse.
And the computer scientist is frustrated because he wants a mathematical formulation, sum over I, x, I, something, and that's just not coming. So it is a very difficult problem. I think the main thing we have sort of come to understand is that when we are, when we're doing this sort of work, this human time, we have to sacrifice, I mean, very bluntly speaking, number of publications is going to go down. But on the other hand, there's real world impact. And that's just the trade-off that we have to live with. And they're not going to be the number of papers in the top journals that some other research group may be able to produce at that same pace. It's just going to be slower. But what I found in my experience is that people on the hiring committees, promotion committees, and so forth are smart, and they seem to, and they are able to understand that this is a balance that was achieved. And so I feel, it's not necessarily me, it's for the students who are going to take that risk. That is kind of works out in their favor, because they get this real world result. And I think it's, and then that allows them also to build up a career that is different from what that is done. Now we have people, my students who are well trained in terms of, okay, I know how to work with social work, I know how to work with public health, I know at least this sort of friction, lower numbers of papers, maybe papers from some papers will go into another disciplines, journals, etc. But they try it because now they are different, somewhat different from the other AI researchers who are out there. And so there's a different kind of work. So I don't know if that answers your question, but that's the way we want to do it.
Yeah.
Thank you very much for the amazing talk. And my question is also relevant to your answer to the previous one. And when I was listening to your talk, I have a feeling kind of like what you presented with all what we have read in the introduction happened. Because when I was working with my students, they are in computer science. They write a lot of stories in introduction, especially the first paragraph.
Yes.
But then when we look at about the other part of the paper, it's all about methodology, some novel techniques. So when you were talking, I have been thinking, how can we encourage our students think more about the social impact of their research work, and should we introduce something in our graduate student education? Because I'm teaching machine learning, but my course is mostly about machine learning techniques, methods. I probably introduce something about application, but it's very limited. So can you give us some suggestions, not only to me and also maybe to the graduate students here? How can we define our research problem from the real life, not just reading some paper and then I have another research idea based on the paper also?
So, many different parts of this is very, very reasonable. You can do very fundamental research. That's awesome. More power to you. We have chosen a different path where we actually go to a non-profit, and until we get a real problem from them, we wouldn't work on those problems. With respect to training, I completely agree with you that if we train people only in methodological AI work, then say, hey, go do this AI society work, it doesn't work like that. It's really difficult to do that work. You need better training. I know that Nitesh teaches a class on AI is good. So I also teach something in AI for social impact, but that's just, in my mind, beginnings. We need a lot more training to be given to the students. When I look at my colleagues in the School of Social Work, the kind of training they get, some of that, or my colleagues who are assistant professors and so forth, implementation science in public health, some of that. So some of this interdisciplinary training from these other fields, social work, public health, conservation, etc., needs to be cut, needs to become part of our curriculum of AI for social impact so that people get better training in terms of this type of work. It's a commitment to a different path, I feel, in terms of when you talk about, there is the there's the approach of improving methodological, making methodological contributions, and some people definitely need to do that. But, and I would say even in AI for social impact, we shouldn't be in a situation where we're using 1980s AI technology, because the social impact wouldn't be as much, so we need to also keep up, we need to make some of those basic contributions as well that are more appropriate for our age. But, yeah, it's fundamentally going to be a different kind of work, and, the final piece I'll say there is that it is also important that our conferences, our journals recognize this impact. And to that end, I'm very pleased to see AAAI has a social impact track. So there, the review criteria are different. It doesn't have to be a methodological contribution, even if you use the exact known algorithm, but to show real social impact in the field, the paper is accepted. Same with each guy now. And I hope that other conferences, KDB, ICML, maybe KDB does this already, but ICML, what have you, will also adopt a similar standard where these kinds of papers are given the same prestige, the same value as other papers. And if that doesn't happen, then I think we are all going to be in trouble for this field if we want to be social impact. So that's something that all of us really need to push our different communities to say, you've got to make this a first class citizen of, the scientific economy.
Yeah, I just want everyone message the web conference, the W conference next year, they also have the AI for social impact. So
That's
then
great. Awesome.
So I did have one, and we're a little over time. One technical question, just when you were looking at these Markov decision processes, and you're looking at transition states 1 to 1, but do you sort of get into a challenge of the entire preserving the memory of the system? And that's where some of the scale issues would come up with these Markov processes.
Yes, so right now we're sacrificing a lot in terms of saying, I'm only going to remember what happened last week or this month. Because, yeah, I mean, if I remember, it would be better prediction, but the computational challenge would be more. So it's just a trade-off made that I'm just going to remember last week's state and then predict next week's state and then, forget it, and move on in this fashion. But you're exactly right. If you could keep more memory, then we would be even more accurate, but it's just the trade-off that has to be made.
There is nothing else, let's start with Tambe again.